Have you ever wondered why doctors quickly hook you up to an EKG when you're rushed to the emergency room? Well, there's a pretty good reason for that. Diving right into it, an EKG or electrocardiogram is a medical procedure that records the electrical activity of your heart. Now, you may be wondering, why is this important? Well, the heart, like any electrically powered device, operates on electrical impulses. These impulses control the rhythm of your heartbeats, ensuring that your heart pumps blood efficiently throughout your body. An EKG is like a heart whisperer, translating these electrical signals into a language that medical professionals can understand. It paints a picture of your heart's health, and this picture can reveal a lot. For instance, it can detect if you're having a heart attack, a life-threatening condition where the heart's blood supply is blocked. As you can imagine, this makes it an invaluable tool in emergency situations. But the capabilities of an EKG don't stop there. It's also used for diagnosing a variety of heart conditions, from arrhythmias, which are irregular heartbeats, to heart failure, and everything in between. It's quite the detective, isn't it? And here's another fascinating fact about EKGs. Sometimes a person may have a heart attack without even realizing it. These are known as silent heart attacks. They're like the phantom of the cardiovascular world, often going unnoticed. But guess what? An EKG can unmask these silent threats, further emphasizing its importance in heart health. So, an EKG is a crucial tool in the hands of medical professionals, allowing them to quickly assess the state of your heart and make life-saving decisions. But what if you're not in an emergency room? What if you're at home or at work and you start to feel unwell? This is a scenario that unfortunately many people face. Recognizing the signs and symptoms of a heart attack is critical in such situations. Heart attack symptoms can vary widely, and they don't always present as the classic chest pain that we often hear about. Some individuals, particularly older adults, those with diabetes and women, may experience atypical symptoms. These can include discomfort in the upper body, shortness of breath, cold sweat, nausea, or lightheadedness. It's crucial to be aware that these symptoms can be just as serious as the more commonly recognized chest pain. Understanding these variations in symptoms is not just a matter of curiosity. It's a matter of being able to recognize a potentially life-threatening situation when it occurs. If you or someone around you starts to experience these symptoms, it's crucial to seek medical attention immediately. Time is of the essence in these situations. The sooner you get to an emergency room, the sooner doctors can perform an EKG and other tests that can confirm a heart attack and assess the damage to the heart. This isn't about being paranoid or living in fear of a heart attack. It's about being informed and prepared. It's about understanding that heart attacks can happen to anyone at any time, and they don't always look the same. It's about knowing what to do when the unexpected happens. We all hope to never find ourselves in this situation, but if we do, recognizing the signs and symptoms of a heart attack can make all the difference. It can mean the difference between getting to the hospital in time for potentially life-saving treatment and not getting there at all. Recognizing these symptoms and seeking immediate medical attention can literally be a matter of life and death. So arm yourself with knowledge, pay attention to your body, and don't hesitate to seek help when you need it. Your heart will thank you. So we've talked about EKGs and their role in diagnosing heart conditions, but did you know they can also be used to assess the risk of future heart attacks? EKGs, or electrocardiograms, are not just diagnostic tools, they're also predictive ones. They provide a window into the heart's electrical activity, enabling medical professionals to spot anomalies that could signal potential heart problems down the line. Now let's delve into some of the risk factors for heart disease. Age is a major one. As we grow older, the risk of heart disease increases. An EKG can show signs such as an abnormal heart rhythm or damage to the heart muscle, which may suggest an increased risk of heart disease in the elderly. Diabetes is another significant risk factor. High blood sugar levels can cause damage to blood vessels and nerves that control the heart, making people with diabetes more prone to heart disease. An EKG can help identify changes in the heart's electrical activity that might indicate such damage. In addition, women may present with atypical symptoms during a heart attack, such as fatigue, nausea, and shortness of breath, rather than the classic chest pain. An EKG can be crucial in detecting silent heart attacks that may go unnoticed due to these unconventional symptoms. EKGs can also reveal if a person has had a silent heart attack in the past. A silent heart attack occurs when blood flow to the heart muscle is severely reduced or cut off completely, but the person is unaware of it. This is a clear indication of an increased risk of future heart attacks. It's important to remember that while EKGs are an invaluable tool in risk assessment, they're not foolproof. Other tests may also be needed to confirm a diagnosis and assess damage to the heart. Therefore, EKGs not only help in diagnosing heart conditions, but also play a significant role in predicting potential future heart issues. You might be wondering, is an EKG all I need? Well, while it's an incredibly useful tool, there are other tests that doctors may order. EKGs are indeed a cornerstone in the diagnosis and management of heart conditions. They provide an instantaneous snapshot of your heart's electrical activity, which can reveal any disruptions that might indicate a heart attack or other heart conditions. But they're not the be-all and end-all. Just as a mechanic uses a variety of tools to fully understand what's under the hood of a car, a doctor leverages an array of tests to get a comprehensive picture of your heart's health. These may include blood tests, stress tests, echocardiograms, and cardiac catheterization, among others. Blood tests, for instance, can detect certain enzymes that leak into your bloodstream when your heart muscle has been damaged by a heart attack. These enzymes are like silent alarms, alerting doctors to potential trouble. Stress tests, on the other hand, measure how your heart responds to exertion. It's like taking your heart for a jog and seeing how it holds up. This can help uncover issues that might only become apparent when your heart is working hard. Echocardiograms use sound waves to create a detailed image of your heart. Think of it as an ultrasound for the heart. This can help doctors see if the heart is pumping blood efficiently and identify any structural abnormalities. Lastly, cardiac catheterization can provide a more in-depth look at the coronary arteries to check for any blockages. It's a more invasive procedure, but it can provide critical information, especially in emergency situations. Each of these tests offers a different perspective, and together they complement the information provided by the EKG. They help doctors confirm a diagnosis, assess the extent of damage to the heart, and devise an optimal treatment plan. So, while an EKG is a critical tool, it's just one part of a comprehensive approach to diagnosing and managing heart conditions. So, what can you do to take care of your heart health? The answer to this question lies in 4 key areas. Firstly, regular checkups are essential. They allow for early detection of potential issues, and remember, early detection can make all the difference. Secondly, a healthy diet is paramount. It's not just about what you eat, but also about how much and when. Opt for foods rich in omega-3 fatty acids, fiber, and lean proteins. Thirdly, let's talk about exercise. It doesn't have to be strenuous or time-consuming. Even moderate-intensity activities like brisk walking or cycling can significantly enhance your heart health if done consistently. Lastly, but by no means least, is stress management. Chronic stress can take a toll on your heart, so finding healthy ways to relax and unwind is crucial. This might mean reading a good book, taking a leisurely walk, or even meditating. While medical technology like EKGs plays a vital role in heart health management, the importance of prevention cannot be overstated. Remember, your heart is in your hands. Take care of it and it will take care of you.